it's Leah here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County. So if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody. We were just having a lot of fun getting ready for this show. We all had I shouldn't say all of us. I had my earphones on wrong. So, first of all, hello, Melissa. She's our new producer. Boy, they changed producers like I changed my underwear.
It's Marissa, right?
Marissa?
Melissa?
I'm Marissa. She's Melissa.
Oh my God. A Marissa and a Melissa. This is going to be a tough one today. First of all, hi, Linda. She's on the board here. And we got Freddy from AM2.TV.
Good morning, Slash.
And we got Gio up there. But we cannot do the show unless we announce the most important guy. And that's me. Oh, I'm sorry. That's Dr. Pannozzo. Hi. Hey, Doc. How you doing today?
I got to bring him up right.
How's everything going? How you feeling?
Well, pretty good today. I think the allergy season's slowly going away,
thank God.
We're doing better.
You know when you're getting old, when every commercial on TV about medicine you're taking, that's very bad.
Everything on TV is what you're taking?
There's only one I'm taking, Viagra.
Oh, okay.
Okay, so.
That's not medicine, but okay.
It's medicine for me.
I'm pretty sure.
Okay, are we going to do Coach's Corner first?
No, we're going to say how you can be seen.
That means I said something funny.
Oh.
It's like a standing ovation. Yeah. He's giving himself an ovation.
The Greek does it every day, so I figured if he's successful, why can't I be?
Oh, the Greek. Is he a funny guy or
yes,
what?
Yes, he is, and he's a great guy. I'm so happy that we have him on our team as well as with Linda.
That's right.
As well as with Leah.
Leah.
So tell me what we're going to do today, Freddie.
What I want to talk about first is let everybody know about the call-in number.
Okay, the call-in number is 800, which is toll-free, 889-0267. You can ask Dr. Pannozzo anything, and if you're a doctor that wants to dispute him, please call. We'd love to hear from you, 800-889-0267.
Correct. And you can hear Dr. Pannozzo on WBZT 1230 and
94.3, except, he's on today.
Yes, he is.
Yes, I forgot you're on 94.3.
Except for football games.
No, Dolphins are playing at 4 o'clock, so you're on today.
And also Pannozzo.tv on your computer if you want to look at me live.
Let's spell that name. Pannozzo.tv. See what the doctor has accomplished. Yeah. Meet people. You could go look at him on Facebook. Almost everywhere he's there.
Yeah, everything's on there. You should tune in.
Okay. That's right. And we have the chat box open on Pannozzo.tv.
Oh,
so you can chat with us if you want. If you don't want to call in.
So, Mr. Santori, tell me what new thing that we're going to do today that no one told me about.
Well, what I want to talk a little bit about, you know,
what happened?
You know that.
Are you plugged in?
I hear the show.
Oh, well, okay.
Did you hear it or no?
No, I'm okay.
No, I didn't.
Okay.
I don't hear anything.
No, that's on me. That's good. Oh, we're good. I put your website up and I'm hearing it. Okay, as we all know that the Pope is in town.
Yes, he is everywhere.
Am I getting it?
We're all good.
We're good.
We're good.
Yeah. You know this is a live show, folks. We don't rehearse.
Are you good?
If we rehearsed, we'd be dangerous.
Yes, we would be. We'd really know what we were doing.
I know. Okay, the Pope is in town.
Uh-huh.
And Pope Francis suffers, Doc, from sciatica.
No, he doesn't.
And he has a bad left knee.
No.
And he's wobbling like a weeble.
Who said that?
I saw it yesterday and the day before on CNN. I've been watching him talk in Philly.
Well, he has a right hip.
Yes, he does.
It's not sciatica. It's a right hip.
This is the diagnosis.
I know. That's wrong.
But I found it kind of that the Pope is in town, his little fiat, and I wanted just to bring up the same fact that His Holiness, because I am Catholic.
Let me tell you something. I love this man. I think it's about time we got someone that's really, really. I've watched him. I admire him immensely.
Well, my whole kicker here is I'm gonna send a letter to
The Pope?
to the Pope, because they do answer. By the way,
Really?
yeah, they do. All the millions of letters he gets, they do answer. But the bottom line here is that I want to let him know, His Holiness, that he doesn't have sciatica, and he doesn't have that bad knee, because I think they want to perform surgery.
I know he should not do that. He
And
doesn't
he
need
just lies in fact.
Yeah, he just slide in here and we'll fix him up.
That's right.
Right now, actually, you could come in if he wants.
I'm a
He
great.
can even call us right now.
My biggest fun I have at the airport is watching gates.
On people?
I watch them walk, and then I got to figure out what's wrong with them, and that passes the time quick. So you can wait for a plane. You have to do something.
You have that little book that goes, this guy has scoliosis. This guy
Well,
has...
you know, you're going to laugh.
But
When we go to dinner, like we went to Fishbone Grill last night,
Oh, great restaurant.
I watch people's gates too now, thanks to you. And Linda has a $10 off coupon. She must have like 50 of these things, right? And what is
Sounds
she?
like my wife has a whole bag of coupons in her wallet.
So we watch the people that come in with the walkers and the gate and the biggest, and Linda goes over and hands the coupon to these people. Says, "Here, call Dr. Pannozzo. You need him."
Linda, that's nice. Thank you.
And I tell Linda, we're gonna get killed one day.
You know why she does it? Because she wants to help people.
Yeah,
Yes.
'cause she's Linda is that kind of person.
Well, that's what she does
Yes,
for a
she is.
living.
She really cares about people. I've seen her, and she does care.
But it's everywhere, Doc. Then we go to the movies. I said, okay, enough, sit down. Because you've gotten us into the habit of watching people's gates.
Hey, I saw a guy at the gym, which is a patient of Dr. Pannozzo's now, and he said, I had 4 knee surgeries. What's he going to do for me? I said, probably make you so you could walk, maybe play tennis like you like to, maybe work out at the gym. So I went up to see Dr. Pannozzo. He comes to me the next day, I swear. He goes like, they see my face? That guy really knows what he's doing. He yells at me, but he really knows what he's doing, because now he went and played tennis.
Well, you don't have a knee left.
Right.
You have a piece of metal.
Yeah, which is amazing. And
The
he was
metal-
in such pain.
The metal is inert. So
What does that
what's-
mean, Doc?
No reaction. So what is causing the pain? Well, scar tissue from the surgery. That's what it is. It's a leftover of the surgeon when he puts your tissues together. So you have scar tissue. Also, phantom pain is the same thing. And
That's like when you lose an arm or something, and people think that they still have the pain there.
yeah, but
Okay.
what it is inflammation at the end of the nerve.
Okay.
It still causes an electrical impulse up to the brain, which is what you're feeling. And so we take care of all that stuff. But
And Doc, does that inflammation, that tissue, that scar tissue, does that ever dissipate? Does that ever go away?
yeah,
Is it
it's
sore?
treatable because it's just an inflammation.
Right, but if it isn't treated, and I have that
Well, it's a
scar
long
tissue,
time. A long
Years?
time ago. Well, it could be.
can you get infected in
But
the
you
area
spend a lot of
because
time chasing it around. There's drugs, there's therapy, there's chiropractic. None of that is going to work. It's a technique. You have to get the technique, and I have it. It's called musculoskeletal medicine or physical medicine. This is what I do for a living, and nobody else does that.
Right.
The surgeons don't do it. Nobody else does it. We have a niche. We're a niche player for painful people, and you should take advantage of it. Those listening out there, this is the best you can get.
And I have a little fun fact. I'm glad you said that. Do you know how much money insurance companies paid out last year for surgeries that shouldn't have been performed? $3 billion with a B dollars. And according to a survey that USA Today found out, over 180 surgeries per year are performed that should not have been performed.
Really?
That should not have been performed.
180?
180,000.
180,000.
That shouldn't have been performed, and climbing every day. And let me just give everyone the definition of surgery. Okay, do you mind, Doc? I mean, you know what it is. A lot of people don't. The definition of surgery is the treatment of injuries or disorders of the body by incision, especially with instruments. The branch of medicine that employs operation. So let me explain that in the right
Regular
nomenclature.
terms.
Regular terms. Surgeons have to perform operations. There are great ones out there. That's all they know is surgery.
Right.
They don't diagnose. They get that MRI from, as you always talked about, from the guy who hands it to the doctor and says surgery. That's what they do. Surgery. That's all they do.
Everybody does. Everybody's solution, failed medicine, as Dr. Pannozzo says, becomes surgery.
That's actually, it's a failure of treatment.
Yeah.
Exactly.
So when you're a medical doctor, you're thinking about, and we all are medical doctors, and if you have to have surgery, it's a failure of your treatment.
That's correct.
It should never be looked at as anything but a failure of treatment.
And one of the things.
And you're not going to do well with it either.
No, they say that. They say the most common surgeries that orthopedic surgeons do are spinal injuries, rods for scoliosis, knees, especially knee replacements.
Oh, well, knee replacement should never be done.
No.
It's so easy to treat a knee. I mean, you can't believe how easy it is to treat that if you understand the makeup of it. How is it made? What is it supposed to do? Just because you have so-called bone on bone, that's only about 2-3 inches of it. That's all. And you're throwing the whole thing away for that? You got to be crazy. You never replace a knee for anything. Even bow-legged knees, those are treatable. This is what we do every day. So, I'm not talking theory here. This is practical stuff we do every day. The scoliosis, we just saw a 13-year-old.
Yep. I saw the x-rays, which is unbelievable.
I can't believe it.
We can't tell it. You showed it to me, which I was amazed.
I showed it to you because it's so grotesque. The rods were put in just below the neck, in between the shower blades.
And she was and her
And
neck
she
was
could not
tilting to
move
one
the
side.
neck yet because the bones were rotated, which mechanically cannot. You can't have that because mechanically you're dealing with the tissues that you're not supposed to deal with, connectors of all those bones. It's no big mystery. I mean, it's right there for
How
you.
long did she have it, Doc?
Well, she's only 13, so she couldn't have had it that long.
Wow. So could you help her?
I helped her, but the trouble is these, they've had it. These kids have had it.
You
And
can't
they-
remove those
they
rods,
feel,
can you?
yes, you can.
Well, you can remove
I
the
asked him
rod.
that today, and he said yes.
I said if this was my daughter, I'd get those screws and rods out of there as quick as I can. Then we can treat her and make her normal. 13 years old? Are you kidding?
But he fixed the neck
Oh,
that
my
was supposed to fix it. It was tilted to the left. Am I correct?
Right.
And he gave her a shot, and you could see on the X-ray that she was standing with the neck perfectly.
How did she
straight.
feel?
You got to ask him. I didn't
Well,
meet
she
her.
felt better, but you see, in order for this kid has had it with all that surgery and all that
Right.
therapy, and that she's not willing to take more. So now you have a psychological problem you
That's
have to
right.
deal with. But they don't understand that you can live to be 80 years old. You can't live that way from 13 to 80.
With those rods.
You're going to have a miserable existence. You have no idea. And we try to tell her, but I mean, it's tough, and I feel really bad about it because there's no reason for it.
No.
This could all been fixed.
Well, Doc, a couple of weeks ago, I told you the story of a friend of mine who had double hip replacement. And I spoke to her last week. And she says, I have never been in such grueling pain in my life.
I believe that.
And she wrote it on Facebook. And she got a whole load of comments. And people were encouraging her, hang in there, I had it. I know the pain, I know what's going on, hang in there, hang in there. And I looked at her and I said, what I don't understand is I asked you to come and see Dr. Pannozzo for one visit. And you wouldn't be going through this. Just one visit. Maybe it takes 2 visits. But at least we would have put a plan together that's better than this. Then I said, and then you wrote it on Facebook, and look at all these people. I mean, there were hundreds of people who've agreed to do the surgery and endure that pain. It just doesn't make any sense.
No, people are not thinking. It's a thinking process. They're not calculating properly. They're just believing people when they tell them, oh, the surgery is great. In a few days you're going to walk. That is not true. That never happens that way.
They're going to have to go through rehab, the pain of rehab.
Well,
and
what if
everything.
she has a back component?
Which, in looking at her gait, I know she does.
Okay, see, so that looks like hips.
Yep.
But unless you know how to diagnose that, you're not going to get it.
Wow.
Now, we just had a guy in there this week. I forgot to bring the charts. I was going to bring the...
That's why we were so late today, because he was showing me these charts that blew my mind.
The patients that we saw for the week, and that's it's on my mind, and I can describe them, what we're seeing every day. So we treated this man's foot, and he had a foot problem, and pain left. Well, 2 weeks later, the pain came back, and he said, all that pain came back. I said, well, where is it? Well, it was a different place. And I said, how's your back feel? Oh, well, he didn't know. So I took a picture of his back, and then we put him on the C-arm and gave him 2 shots in the back. And inside of 5 minutes, that pain in the leg, the foot was gone. It was a referred pain. So you have to be able to pick. Now, this is a diagnostician. I mean, that's what I do for a living. You have to diagnose properly, or you can't get the result that you
Cause
want.
and effect.
It's cause and effect.
What causes the pain?
Absolutely, right.
I learned that from Dr. Pannozzo. That's why it's so fascinating when I bring people in, and they're very skeptical, and then all of a sudden they go, oh, the pain's gone.
It's not what you think. A lot of times, if you go to, depends on who you go to.
Mm-hmm.
You get a diagnosis that may not be right, especially from an MRI. Remember, a radiologist is reading those. They don't know what you look like.
They don't know the cause
They don't
was
know
either.
the history you have. They don't know what causes that pain. They're just reading it. And they'll say, bulge here, bulge there, bulge there. That's not true. It's not what does the pain. In other words, from an MRI, you do not get the source of the pain.
Correct. I know that.
You know that?
Oh, yes, I do. Because
People don't know that because they're bringing their MRIs into me, and I just go, holy cow.
But didn't I tell you people don't bring the MRIs?
I told them. I said, do me a favor.
Don't bring them.
I said, don't bring your MRI, because if you go into him, everything else has failed. So let him fix you. And if you want, take the MRI, put it in a nice frame, hang it over the bed, because
Yes.
I don't have this pain anymore. Because I saw Dr. Pannozzo.
Let's not demean the test. The test is okay,
No.
but does not tell you. Well, look, my the thing is that I'm particular in what I'm saying to you.
Mm-hmm.
The MRI is good, but it does not tell you where the pain is from.
Well,
Okay? Now, that should just leave it like
we're
that.
going to stop right there. I'm not going to go any
Right
further.
there. Right
But I'll tell you something. In US, I'm going to tell you, if you want to go up USA Today, everything I'm going to give you today, you can look up yourself. I'm not going to read all the information. One of the things USA said is always get a second opinion that is non-surgical before you go in for surgery. It's your body.
We had some guy come in there with, a lady, 5 opinions. And I said, well, who did you go to? They're all orthopedic surgeons. And I said, well,
They're going to give you the same opinion.
They're all trained the same, and they all will have the same opinion.
Remember, folks,
This is
the word
first time-
surgery.
This is the first time you come to a non-surgeon, and my opinion is against what they told you. That's why you're improving already.
See,
You
what-
know, you have to think. Thinking process is important. You got to think properly.
Especially it's your own body.
Well,
You know, you can lose money in the market and go broke, but you have a shot of getting back. Once you get a bad diagnosis and you're in pain the rest of your life, unless you see this man, because I know it firsthand.
I look at it this way. If you can invest 1 day
That's all.
or 2 days with me, you'll find out a lot. I mean, it's information you can't buy ordinarily.
Well, the problem
You know how hard
is,
it
you
is
short
to get,
people the first
you
day.
know how hard it is to get expertise in anything.
Look how long you've been doing it.
You have to look around. If you buy a car, you got to go several places to find out what's good.
That's what's funny. People will go 7 places to find out what's the right price, but they won't. But they won't go to get an opinion that's going to be. Was it 99.9%, as Leah said, that you fixed?
Now, we talked to somebody in San Francisco. The dad wanted me to talk to him. I talked to him. He was misdiagnosed over there. Had been treated for a year. I could tell what he has because this is what I do for a living. I'm not a surgeon. He was being treated by a surgeon who do not do diagnostic work. Anyway, I said, you just fly in here and I'll take care of that for you. And you don't have to take any drugs. You can earn a living. You can do whatever you want right away.
Mm-hmm.
Oh, I can't sit that long. You throw up your hands. What are you going to do?
You get up and you
go
walk
to
around the
Phoenix.
plane.
Go to Phoenix with Paul.
Phoenix.
He'll
Yeah,
take
you'll
care
be
of you.
right there. Actually,
Well, I don't know if we can do that. No, see.
No, this is the guy who doesn't want to get better.
You just hit the nail
I mean, that's okay.
right in the head, buddy. They don't want to get better.
It's
They want to
okay.
complain.
And talking about the psychology of what you do, the NFL has, because we had a lot of calls and emails about concussions, about what we talked
great.
about last week.
Yeah.
The NFL protocol has changed, and I don't care what they say, because I see Jet players, I see the Browns quarterback and the Jet player, I'm not going to name them, who were injured in the same game, and they've been cleared to play today. That's 2 weeks.
Wow.
Now, the protocol usually lasts 4 weeks. Even one of the players said, they cleared me to play. I don't know what to say. I'm surprised, because normally it takes longer. Now, they're going to put a dark shield or dark contacts on this player
Really?
because the sunlight bothers him.
Vertigo.
And he has-
But that's migraine.
Yes. And he has migraine,
Yeah.
and he has a vertigo,
Yeah.
and he has a dizziness.
Yeah.
But they cleared him to play, Doc, because these star players have to be on the field.
Of course.
Well, I don't know why these players don't take control of themselves and just come in my office. What you're describing is a one-day treatment. It goes real fast.
Well, I have a theory.
Okay.
I think they listen to your show,
They do.
and they are now attacking the area. They don't know what to do with it,
No.
but they're freeing them up to play. Big difference in protocol.
But that's he's become a sacrificial lamb. You might as well go back to the old days when
Well-
they killed lambs for the god. I mean, this doesn't make much.
But what they're saying is that there's no danger to them, supposedly, okay, because they were looking in the skull. They're not looking in the skull anymore. This is
they
the
aren't.
point.
Ah,
No.
how nice.
So they're freeing up protocol to let them play. Okay? So that just tells me that what you've been saying, that we had the conversation last week, I got all these emails this week, is perhaps the same region of vertigo and the same region of the concussion is in that area.
Yep, it is the same. Yep.
And
We
they're
know
freeing
that
them up
for
to
sure.
play.
We know that for sure.
Harvey pitched for the Mets. Hey, congratulations to the Mets, my team, for winning the division
Yeah,
first time in
right.
9 years. Harvey pitched for
There
the
go
Mets.
Mets.
He pitched 91 pitches, 6 2/3. He pitched 60 against the Yankees. When they took him out, Mets were a disgrace. But it goes to show you the arm is sound. So this is all a contract ploy. So we'll see where that goes.
Oh, well, we're after this elbow business. No surgery for the elbow, ever.
Well, there was a big
Don't
article
need it.
about Tommy John surgery, and they said before you send an athlete in for Tommy John surgery, you're only hearing the ones that got better.
That's right.
Let me tell you about all the ones. Yeah, that's right.
24%.
Got better. The rest. Yeah,
The rest are
They-
in the minor leagues or not pitching anymore.
that's exactly right. So with a 24%.
We don't know how many good athletes got screwed by that. I mean, it's just.
Well,
I mean, as a physician, I really feel bad about this.
well, I got a better one for you, Doc.
my stomach aches when I hear this kind of stuff.
I was watching.
Excuse me. Did you ever hear of a Patel pitcher by the name of Patel?
No.
Oh, okay. Because he was a pitcher that went for Tommy John surgery, and he's not. He can't pitch anymore.
He can't even probably lift his arm anymore.
He could. If he comes to see me, we can fix that.
Oh, I didn't
Isn't
mean to
that
interrupt
scary?
you. Yeah, it's scary because you know what? Again, it goes back to the it's a progression. You go to your family doctor and say, every time I pick up my arm, and what's the first thing the family doctor says? He said, hold on, Shirley, come here a second. What's the orthopedic guy that handles that? He sends it to the orthopedic surgeon. First thing the orthopedic surgeon said, again, there's nothing. I don't poo-poo orthopedic surgeons. I don't. To go, he gets an MRI at the place. The guy takes the MRI and hands it back to the doctor. The guy says, okay. What caused that pain? So I'm trying people to understand.
You cannot tell from an MRI.
No, of course not.
They'll report a rip, a tear, this
Right.
and that, and you can't get all that. That's crazy.
And the word
get a
surgery
tear.
means what, Doc? Surgery.
Surgery. Well, you have scar tissue to begin with.
And
That's
where
what
do you
the
go for
pain is.
surgery?
You get more.
You go to the hospital.
You get
and how
more
do hospitals
scar
survive? By more surgeries.
That's right.
That's why the doctors don't really like you for that reason. You cure a patient in one day. Oh my God. How does that guy
Stop doing that.
survive?
Stop doing that, Doc. Stop fixing people.
I am not lowering my standards for anybody.
You
I told
should.
that to the Blue Cross guy
Did you?
who called me up. I got to give him credit for that. You want to know, what I thought about it? I said, leave me alone. I do the best job you can get. I save you money.
How about billions of dollars a year that they're paying out because of people they're suing them?
Yeah.
This is the doctor you told me I had to go to. It was on your plan. I went to. I can't walk.
That's right. The lawsuits behind that as well.
Yeah,
And
billions of dollars.
and it's a psychological move. You know, bad in is bad out. And if
That's exactly right.
And if you keep going and getting the wrong thing done, and that grows and grows, like Dr. Andrews in California. Hey, listen, he does ACLs for a living, okay, but that isn't the only solution.
ACL? Don't get me going on ACL.
Well, I was watching the college games yesterday. Hamstring, groin pulls,
Yeah.
ACL tears,
Yeah.
knocking out the majority of the kids. The kids are getting bigger, faster, more mobile, more stronger, more dangerous.
Yeah. When they hit, they hit.
When they hit, it's like getting hit by a train now. So,
yeah, but you still can't get all that. You can't get an ACL no matter what.
but this is my new point. Now, these kids are on the shelf. They're not playing. Hamstring, 6 weeks, Doc. 6 weeks.
Look, an orthopedic surgeon should not be in charge. Okay? Because they don't diagnose. They do surgery. Who does all the treatments? Trainers. What do they know?
Oh,
They're as bad as therapists. They don't know anything. They're not
I-
trained. They're not trained to
That's
diagnose and treat. They don't
That's
have
right.
anybody in there who gives them good advice and has the techniques to take care of these things. I have the techniques, but they're not calling. I feel real bad.
Hold a second. So you mean the physical therapists, right? Is that what you're
Yes,
talking
physical therapy, orthopedics.
Well-
Hamstring injury, they're treating it with ice, compression, and on the shelf.
about? So let me talk to you about physical therapists.
Just think about that. Think of the thinking process that goes into that. That muscle is so big, you can't hurt it. It does everything it's made to do it. If you bend forward 90 degrees, 180 degrees, what happens to your hamstring? It stretches. It's made to do that. So how the hell do you hurt it?
Well, Chris Ivory may
You
not.
can't.
He may not play today because of a hamstring.
It's a referred pain. It's coming from somewhere else.
Probably his hip.
Could be hip, could be lower
And this
back.
is a running back.
Yeah.
When you tackle a running back who's as big as
And
Ivory,
what do they land on?
their hip
The hip.
and their buttocks.
Is this hard?
It isn't, and that's why. And I gotta tell you, I was in sports for 22 years, and the more I listen to what you say, the more it makes sense because I see how people fall.
What took you so long, Freddy?
Well, because I never knew that you could have a pain.
I never
because
knew
of a
about
different-
him.
Well, you told me to go see him, you chicken.
I went to see him.
After 3 months after I went.
Well, but did you get a needle in the groin? I did,
Well, you should have gotten a needle in the groin. You deserve a needle in the groin.
and I feel better.
We saved everything else, though.
Well, hold it. Yeah, he stayed away from the boys. So let me just tell you this.
Could have made you a girl.
Listen to this. Physical therapist. I actually spent some time.
Get the number out. We got to have a call or
Okay,
two.
800-889.
Call me. I'm getting lonely.
0267. Yeah, he's getting lonely here. So come give him a call. Stump the doc. If you stump the doc, we give you dinner for 4. Okay? 800-889.
When did you increase it to 4? I thought
Well,
it
we'll have
was
to want to bring another couple. I can increase them to 6. They can't stump us.
Yeah, they never collect.
Yeah, we can do it to 8. I don't care. So it's 800.
Good old Francesca. She's waiting.
889-0267. Freddie, I don't know if you knew this. You know what the usual education for a physical therapist is?
2 years in
Sing Sing.
2 years in medical school.
No medical school.
No.
2 years college.
3 years, and they can do it online.
Oh,
So now
Jesus.
here's my problem, okay? You do it online, so you're not working on someone's body. Hey, honey, come over here. I want to work. The guy says I have to move you this way. So what I'm saying to you is they're not trained to do this, and they have them on the field. I would say they do more harm than good. This is just my opinion, folks. So if you want to yell at me, yell at
Can
me.
I give you a story about?
Yes, please.
There was a lady in a wheelchair with tremendous pain, and the therapy would just try to walk her 5 steps, and then 5 back in the wheelchair the rest of the day. So the son calls me up. Could you take care of my mother? I said, absolutely. Bring her in. Took me 2 days, 4 shots, and that pain was gone.
Mhm.
Okay, now we wanted to rehabilitate the knee, so we ordered stuff for the therapist. You know what the therapist did? You like to strangle these people. And
This is a lead that you worked on.
Yeah.
she wouldn't do the work. All she wanted to do was walk that person 5 steps and 5 steps back. So she referred her to an orthopedic surgeon and told the son that it was better. The orthopedic surgeon was better. They sabotage really good treatment. This is what they do. You see why I'm against them so much, because they're not honest.
But wait a minute. You took care of the pain in the knee
Yep.
and the leg.
Yep.
And
No,
then
the
you
back.
went
It
in
was
the
the
back.
back, yeah.
And then they went to see
I want her to rehabilitate the knee.
The knee. And then they suggested to get the knee operated on?
That's right. Orthopedic surgery.
Are you kidding me?
No, I'm not
And
kidding.
did the person call you?
This happens all the time.
Holy
Because in nursing homes, by law, cannot do therapy without a physical therapist hired. That's $150,000 a year you're paying those people. And all they do is walk somebody from here to there, 5 steps and 5 back, and that's required.
And you own those facilities.
I own them. I know what I'm talking about.
Yeah. I just want people to know he's just not saying he did own them. Oh, we got a call from Richard. Hey, Richard.
Good morning.
Good morning, Richard. You here with Dr. Pannozzo?
Pardon me?
Did you have a question you wanted to ask Dr. Pannozzo?
You're on the air.
You're on the air with us, Richard.
I'm 73. I've been running for 40 years. I'm still running 3-4 miles a day, probably 3 times a week. But my knees are pretty messed up. A lot of wear and tear. But I love running. What does he suggest?
Well, we suggest we look at them because the knees are not that complicated. You don't get wear and tear changes. That whole thing is baloney. What causes a pain in the knee is a ligament structure around the knee, not inside. So you're dealing with a capsulitis. So we find out what it is, we treat that, and you're good to go. You can run all you want.
Yeah, what are the options for treatment?
Options? You just come in and we tell you what you have, and then we treat it. We don't know what you have. See, we can't.
Got to locate it.
Yeah, it's a diagnosis. It's not inside, though. I'll tell you that right now. It's not
the
inside.
knee. Could be a deferred pain.
No surgery.
It's around the outside of the knee.
Okay, so where are you located?
16244 Military Trail in Delray. That's 16244 Military Trail in Delray. And the doc has his little Rolodex in his head to make an appointment. So if you want to see him, you can call him up at 561-381-5800 after the show.
Right, the knees aren't that...
381-5800, right?
Yes, sir.
Right. South of Linton.
381-5100.
Yeah, 381-5800.
Yeah, south of Linton Boulevard.
381-5100. Let me give him a call.
Okay.
Good.
Excellent.
Do that.
And you keep on running.
Now, I'll give you a good
Thank
example.
you. I want to keep running.
You will, my
I'm
friend.
190.
Guaranteed.
Thanks,
Anyway,
Richard.
We older
Thank
guys got to keep running.
Well, I mean, running, I was a runner for years. And I understand what he's
Running around your house doesn't...
Running,
No, I ran marathons. I wish I would have known you then.
running is important to people.
Yes, it was.
They get a high. I don't know what that's all about.
An endorphin high it is, yes.
I don't run, so I don't know.
We have some guy on here, I think his name is Paul. You want to talk to him today?
Paul who?
Paul who? Paul Pannozzo? All right, we'll let Paul get on the phone. Hey, Paul.
Hey, how you guys doing this morning?
Good. What time is it up there?
It's 9:30.
I'm glad you were able to wake up and call your father. So now we got the 2 Pannozzos on the air, folks. So now it'll be a great time to call. Let's see what father and son have to do. 800-889-0267. Go ahead, Paul.
You guys, what's the topic of conversation today?
Anything you want.
Anything you want.
I just got a text that I wanted to read to Dr.
Now we got a
Pannozzo.
text.
Now I got both of them. This is about the football player who got the concussion 2 weeks ago.
Oh, great.
And they are treating him with tinted contact lenses. The science is developing, but the theory goes that certain migraine conditions can be treated through tinted lenses.
That's baloney. What
You believe
science
this?
is that? There's no science to that.
NFL.
No.
No way. Even I know that.
NFL
I'm not a
doesn't.
doctor.
This is
NFL
coming
has
right-
no science.
This
What are
is
you
coming
talking
right
about?
from jet.com.
I mean, I'm not saying you're wrong, but my God.
They cannot treat that with tinted lenses. It's not where it is. It's at the base of the skull.
They said that the migraines made the concussion worse.
Yeah, you know, you have a head injury, and people are always concentrating on the brain injury part of it, but you can't hurt your head without hurting your neck too. And the pain does not come from the head. It comes from the neck injury that goes along with it.
Yeah, all headaches are from the neck. So there's no science there. I don't know who decides this stuff.
But Doc,
it's just it's craziness, like autism. Who does this?
Right.
Not physicians.
well, this is just it, Paul. We were talking about how the NFL protocol has changed. These concussion players are back on the field 2 weeks later. Used to take longer than that, but they've come to the conclusion it's not in the brain.
Mm-hmm.
Good.
Yeah.
Finally.
What I tell my patients, unless you have a brain tumor or an aneurysm, if you have a headache, it's not in your head, and all that can be found with imaging, MRI, CT of the head or whatever.
Mm-hmm.
You can see those kind of problems, but if that's negative, normal, then it is not in there.
So we developed the techniques to take care of that. So they say, well, what is Pannozzo? We know a lot because we developed the techniques. And when I tell you it works, it works. Try it out.
We had a 70.
I mean, what does it take? One day?
Well, we had a 78-year-old woman and a 45-year-old young lady
In the
in the same office, both getting the same thing, and both of them walked out and said, "I'm going to pray to him." Oh my God! All those years of suffering. Paul, this was amazing. I didn't know they wouldn't both be there.
St. Anthony's already taken.
Oh, okay.
Well, the Pope is in town, Don.
Well, I'm going to go see my rabbi and tell him how great I feel. But I mean, is that
You
amazing,
guys
Paul?
don't have saints, do you?
No, we don't have saints.
You can't make Dr. Pannozzo a saint. You're Jewish.
I'm Jewish, I know, so I can't go. Hey guys, I'm sorry. I still like the Pope though.
Everybody likes
I love
the
this
Pope.
guy. I think he's the greatest Pope we've ever had. But Paul, that was amazing because I sat in the office. I brought someone over who had gone for Botox shots, who's gone through every therapy you can. And as she was walking in, naturally a little skeptical, she's talking to this 75-year-old woman that just had it done.
Well, they both had vertigo.
Yep, both of them had vertigo, yes.
And what they were talking about in the middle of the office, they were standing there talking
for over an hour.
because they all went to the same doctors around to diagnose their vertigo.
Yeah.
And they all come up with the same thing. Nobody knew what a vertigo was. So I said, well, I know. Let's take it.
Well, the other girl also had a TMJ that you fixed.
Yeah.
And all I know is I talk to her almost every other day. I said, "How you doing?" She says, "Well, I could drive my car without getting dizzy."
Well, that's good for all of us.
And she doesn't have
So I didn't like that, Paul. You got successes like that?
Let's see what you got.
Maybe we contact DMV.
The
people who
process
have
is
dizziness.
universal.
Yes, it's amazing.
So
It's absolutely
we get
amazing.
You get the same outcome no matter where.
Mm-hmm.
It's the process and how you treat people. It's not the medication used or whatnot, but it's a process of going through it, and so these kind of results can be had anywhere.
Well, like your father taught me, drugs doesn't get rid of the pain. It just gets your brain to think the pain is gone. Did I say that right?
I think that's pretty good.
That's
Pretty good, right?
There are receptors in the brain, so if you give it the right drug, it'll dull those receptors temporarily. But you need more and more. That's narcotic. That's why narcotics aren't no good.
That's
You should
why
never
the
use
two
that.
of you guys get rid of not only the pain, but the problem.
Yeah,
That's
well,
the difference.
yeah.
Well, I'm going to tell you, Doc, we went on and bought aspirin. We got rid of all the other
Oh, I got rid of Tylenol forever.
Oh, okay.
And we bought aspirin. And I took 2 of those bad boys. I'm going to tell you, wow.
Yeah.
Now she keeps them in her purse. She won't let me attack them. Because I'm going to tell you something, there is no better feeling. And then it lasts a little bit longer. It lets you move.
Yeah, it's much better than anything
Well,
else.
Much better, yeah.
my gastro guy and my liver guy told me, take aspirin. I said, well, he said, aspirin will give you no problem. It's been around for a zillion years. The only thing Tylenol had was great press because they spent a fortune on advertising to convince them. Now, if you watch, if you watch TV now, you'll see that it's a lot of people now that aspirin has come back and the Tylenol is kind of faded away. It's like you won't see a commercial for Botox anymore.
Yeah, it's just like glucosamine. That's gone.
Yeah.
And,
You don't see those commercials anymore because it doesn't work.
doesn't work.
Good storytelling. All right.
Yep.
point
But now, there's a new advertisement for QVC. You got to listen to this.
Oh, don't say QVC. My wife will be on the buying it.
It's something for the back, developed by a chiropractor. And I'm watching this thing because I flip the channels a lot. And so it's a thing that goes on the front of the thigh, here, not in the back. Not in the back, the front of the thigh. And you treat yourself by pushing on the front of the thigh.
Now to the back?
No, that's...
What do you mean you treat yourself? You pump up the volume?
Well, no, you just push on it. It's a piece of metal. And
Sounds a little kinky to me.
now, what I'm seeing is that the front of the thigh is fleshy, so when you push on that, it's going to give there, but local, right there. And they're trying to tell me that the back is being treated, and the nutrients go into the disc, and the disc, the same old baloney that you hear all the time. The disc is dead. It doesn't imbibe nutrients. It's
that doesn't
dead.
sound logical at all.
Oh, cripe's sake! And they're selling that for $29.95.
And if it's on QVC, they'll buy it.
And the chiropractor was right there telling you how good it was. I mean, I can't believe people do this kind of thing. It makes no sense whatsoever.
Well, I got a new one.
Hold it. You're making my job very easy. You mentioned chiropractor.
Oh.
So, Paul, you ready for this one? Chiropractor.
Sure.
A procedure in which trained specialists use their hands or a small instrument to apply a controlled sudden force. Here's the risk of going to a chiropractor. Herniated disc, stroke, neck manipulation can cause vertebral dissection. And it says, do not seek...
Vertebral artery dissection.
Oh, okay. Well, you guys are the doctors. I can't read like that. And here's what they say. Education, 1 year of critical. They are diagnosticians. So in other words, I can only read what... In other words, I'm going to a guy that's going to tell me, I'm going to twist your neck.
Yeah, well, the thing about it is, if the problem's in the middle of the body,
right,
not in the back, how do you treat that?
You twist it.
You can't treat it. You can't get to it.
Doc.
That's why we use shots, because we can get to it.
When I'm at a chiropractor, and he squeezes my neck, and it makes that noise that I think I've broken every vertebra in my body.
Oh, yeah.
And then you go, wow, he fixed me. He didn't fix me. I just want to get the hell out of here.
Well, let me ask you a stupid question. When you watch James Bond, he twists the neck of the guy.
He breaks the neck.
So in other words,
chiropractor twists the neck.
Here's the thing, and the guy goes, "Oh, oops, I'm dead."
What is that all about?
Well, they all twisted it. So this chiropractor twisted a different way. The neck's not supposed. Well, yeah. Hold on a second. Do you know that some states do not require a chiropractor to have a bachelor's degree to be licensed? So one of the things that USA Today said, before seeing a chiropractor, check the education and their license. How many people have you gone to a chiropractor?
Well, there's a big political lobby.
Yes, it is.
There's like 50,000 of them, and they can spend money like mad. I mean, if they want to sway a politician, I mean, the money rolls in like you can't believe. And this is true.
Oh, yeah.
They're good for certain things, but I'm saying they're not diagnosticians, and they can't treat things that they don't even know about.
You just gave me to my next point. Their theory is not based on body knowledge, which you and Paul own that, about the knowledge of the body. That's what makes you and Paul so different in what you do.
That's true.
Yeah.
And if you have scoliosis or you have vertigo, a chiropractor, he's going to be able to help you with that?
He cannot. Nobody can. Except us, and we just developed this stuff. This is new research we do. We do this stuff every day. It just comes. I mean, when you work with it, it comes to you. What works, what doesn't work. Scoliosis has a scar tissue that keeps the vertebrae rotated and curved.
That's right.
If you know where that is and you can get to it, you can release that scar tissue. But it's not a surgical scar that is permanent, like the rods. That's a permanent scar. You can't get rid of that. And you'll get a derotation of the bone. Now, we have an 88-year-old lady that we're treating, and she's gained 3 inches already. 3 inches in a little lady. I mean, she's only this big in the first place.
That could be a whole lot of height.
3 inches, yeah.
And those bones are actually derotating. Paul, you've seen this we see it on the C-arm. And every time you come in for that scoliosis, we pick out the worst spot of the day, and it changes. So in other words, it's progressive, mark it down, which levels, and over a period of time, you can see where we've been and how the thing straightened up. And it's true. It's absolutely true.
And it works.
Take me up on it, ladies.
And it works.
Please.
We've seen it. And if you have a teenager with scoliosis or the hump on the back, before you put them through the rods, ladies and gentlemen, I mean, before you change the rest of their life.
And it will.
And it will, psychologically as well as physically. Come on down, get looked at. It doesn't cost you to get looked at.
That's
but
all.
give a kid a chance.
Listen, if you can't afford it, I'll do it for free. Let's get these kids out of there.
That doesn't make any sense.
Out of the surgery.
I'm hoping that who's ever listening heard what he just said. Can you repeat that, please?
If you can't afford it, I'll do it for free. I mean, what the heck?
Yeah, give kids a chance. It just doesn't make any sense.
Yeah, I mean, and it's amazing.
I'm trying to work my way to heaven.
I don't like
if I can do that.
I don't like heights. I don't know where I'm going.
This
What do you
Pope
say,
Francis
Paul?
has really had an effect on you. First Bonner quits.
Paul, how's the weather out there? I'm coming out there.
Boehner quits.
Is he gone?
Yeah.
The weather's great.
Yeah.
Well, you'll be coming out to visit soon, right?
Sunday, next Sunday.
Yeah. I want to make sure, Paul, you have a lot of things for him to do so he doesn't get bored. You hear me?
Is Paul going to be on the air with us?
Oh, you guys going to Skype? Oh, no, he's
coming to visit.
Well,
he's going to visit.
He's going to be here. He's going to leave Sunday, but he's coming back the following Saturday. So we don't miss shows anymore, Freddie.
I got to get my mail and everything, so I got to get here a day early.
We got to bring Paul so we can put him on that mic over there.
I'd like to see Paul. Hey, Paul, when you think you're going to be coming down to Florida soon to visit your dad?
If I could swing it, it's lots going on over here, though.
I'd like to see it with the mic next to him and really have a great show. I mean, better, well, have the both of them here to answer questions.
We don't agree on everything.
Well, it's not supposed to be that way.
But that's why what you do is so different.
Yeah. Well, what we do is true stuff, and it's all based on the science. So you could argue about science. You can't argue about personalities.
No.
You could always argue about the science.
That's right.
And work it out.
The one thing I've learned working with you and talking to Paul periodically is that you could cure 99% of the patients, actually 99.9 according to Leah, and it's always amazing how people come in like skeptical, like we've had talk show personalities that came in so skeptical they said, "Oh God, man, my freaking elbow." We had the Greek.
Don't you love it when they leave the office?
I love it when they go.
People are in the waiting room and they just say, "Put the V up."
No, I mean, people think I'm kidding. Here's what I tell everyone. If you think we're kidding, go to Pannozzo, PANNOZZO.TV, look up the people and their x-rays. We have it online. Or come in one day when you have absolutely nothing to do, 16244 Military Trail. Sit in the office. Don't even write your name down.
What's Paul's address? Paul, you got an address out there?
He better. He won't get his mail.
8877 West Union Hills Drive, Peoria.
Okay.
Yeah. He's got a nice big office there.
Does he?
Well, he's got 3 offices.
Maybe we should go down there and do a show.
Oh, you want to pay for my transportation to?
Sure. You wait at the airport. I'll be right there.
Should I wait by the candy concession so you can buy me a clock bar?
You better wait by the hotel because you're gonna be waiting
Actually,
a long time.
Actually, in Phoenix, we have 3 offices there.
Wow.
One surgical center, which he does fancy work there. Mm-hmm. I don't do fancy work. We just do the basic, really good
You're
stuff.
old school and he's new school. That's what makes it such a great combination.
Well, he does things that I won't do. Have more technical involvement.
Right.
I rather do volume than that. So, but that's all right. He does good.
Good.
Does very well.
That's curious. I'd like to see some of that.
Yeah, I'd love to go and see what Paul does.
Let's give out the number.
The number is 800-889-0267 if you want to speak to Dr. Paul or Dr. Tony. They're right here for you. If you want to call Dr. Pannozzo at the end of the show, let me specify because we don't want the phones ringing. It's 561-381-5800. He'll make an appointment.
Out there is...
Give me the number out there, Paul. Oh, wait, see if I got the... No, I don't have it.
623-776-8666.
86.
Has anyone called you from the show, Paul? I know it's different times. Probably no one knows that you're on the air with us.
Yeah, I don't think so.
Okay.
Yeah.
Oh, you see, you don't do what your father does. He takes all his own calls. So we know.
He does. He takes his calls.
You take your own calls, too, and make the appointments?
Yeah, I do right now. It's
Oh, good. Okay.
How's that working for you?
Do you have the Rolodex in your mind that you know who's scheduled on Monday, Tuesday, and Wednesday, and Thursday, and Friday like your father does?
No.
He's amazing. He is.
Between all the plates and everything, it gets tough. For me to continue that pattern. I don't know what I'm going to do, if I'm going to continue it or not.
It ain't easy.
No.
Let's read some questions.
Oh, hey, here we go. Let's get the Atlanta questions going. Ready? For all my Atlanta people, Richard, who listens to us on 860 AM in Atlanta, writes, I heard your show on how hamstrings can be resolved. I need to know if that was an error or are you serious? Playing basketball in Georgia for many years, the hamstring issue has plagued me. Are you saying I can get rid of a hamstring injury altogether? Come on, Doc. Let's be real.
100%, yes.
Yes, 100%.
So we're getting real, my friend.
You have to know where it's from.
That's
you're
right.
going to people who don't know where it's from, so you can't get treated right.
Can you guys imagine?
Think. I'm trying to teach you how to think about things.
Hey, Paul, can you imagine if there were no hamstring injuries in the NFL today, how many guys would be playing?
Oh, God.
They'd be overpopulated, I think.
Yeah, it's hard to prevent things, but it's easy to treat.
Yeah,
People talk about prevention, this kind of thing. I find that to be hard.
You cannot prevent an injury.
Or downright impossible. But treatment should be quick and is quick. It can be quick.
That's
Next
amazing.
question.
Next question is Nancy from Atlanta writes, I think the show is wonderful, and I explained to my husband that going down to see you in Boca and staying in a hotel is cheaper than the operation they want him to do on his knee.
Oh, immensely.
Wow,
Wait a
that's a
second.
good point.
Yeah.
They want to replace the knee because for 4 years he's been in horrible pain and can't believe that this favorite doctor could be wrong. His favorite doctor could be wrong. Your favorite doctor is wrong, and tell him why.
He is wrong because an easy to treat. He's gone to a surgeon naturally.
Right.
That's his favorite doctor.
Surgery.
Surgery. Oh.
4 years in pain.
Yeah. So
She's right. It would be cheaper to stay in a top hotel.
Not only that, but you
can
can go to Delray Beach, which is the best in the world. I mean, it's
come down here, play a little
have
golf.
a vacation.
Oh, play some golf, have some great dinners, and fly first class, and it still won't cost you.
It still won't cost.
Go to Poppy's for breakfast, and then go to Francesca's for Italian. I mean, you got the whole thing right there.
And the ocean's not that far away.
No.
You call me, and we'll book everything for you.
In 4 years,
Wow.
he spent 4 years already in pain. Can you imagine?
And when I treat that one day, he's going to say, "Gee, what happened?"
Whoa.
Oh, here's a good one.
Go ahead.
Brian in Atlanta writes, I was visiting my family over the holiday weekend and caught your show on 860 AM in Atlanta. I live in New York City and want to show my fellow firemen how remarkable your treatment is. Hey, Paul, are you eating lunch there?
No, sorry.
As a fireman, we have pain in our knees and the main cause of retirement to fire people. I told them how wonderful your program sounded and want to know if the only way to treatment is to go to Boca. And what is the address of your place? We may want to come down from New York and talk to you in person. Address is 16244 Military Trail. His number is 561-381-5800.
That's in Delray Beach.
That's in Delray, yes.
33484.
Okay. Call the doctor. You'll have a great time down here.
That's a firehouse, no?
A firehouse, yeah.
Fireman. Knee injury.
I guess
Retirement.
from climbing up the ladders with all that weight on their backs.
Why retire with a bad knee?
No.
I mean, it's crazy.
Okay. Let's go another one. We got Josh from Atlanta asked, do you have a plan to help people with flat feet?
Talking to the mic.
Okay. I have worn special shoes and still have the pain in my feet.
Yes, we treat flat feet and we get the arch back. Now, here's the trouble with inserts that you get from the podiatrist. Okay, I never understood this, but they make a model of the foot.
Yes.
And they make something that matches your foot, and that's it. What is it supposed to do? Nothing. Make money for somebody.
Orthotics.
Orthotics.
They don't work.
Now, my idea is that you increase the orthotics to create an arch. And you do that, and it works. So that's my approach. And also, there's scar tissue in the bone structure, and you can take care of all those. And you can get that arch back. We can get half of that arch back in a matter of days. And I'm not kidding. People think I'm kidding. I'm not.
Is that the thing you put in your shoe?
Yeah, I think it's called an orthotic, right?
But it's a replaceable orthotic, not a fixed one like they're selling people now. You're stuck with this flat.
No, I have the one you gave me.
Yeah,
but
well, that's
the one you gave you is probably it's a different one than if you have a Lego inequality. If you have a flashlight. It's a different one.
Oh, okay.
I just want to make sure I take care of Atlanta, then I'll get the other questions next week. Jackie from Atlanta writes, I heard from you how aspirin is the only anti-inflammatory that works and doesn't hurt you, and I got my anti-inflammatories and use it for a week. Wow, you were right. Of course. Now I want to know if an inflamed ankle from skating accident can be a torn ligament, as the doctor told me and said I needed surgery. or can you cure my ankle pain?
We could cure that ankle pain. Stay away from the surgeon.
Okay.
And you know, it's funny because I was going to bring up torn. Everything is torn. Every ligament in the world.
Everything is torn, ripped. I don't know how you get this guy.
Torn.
Oh, yeah.
How do you torn?
I don't know.
How do you torn a ligament? How do you torn that?
You can tear it. No, tear it, but you can't torn it.
Especially cartilage in the knee. You know, that's a flat cartilage. You can't get to it.
They say torn.
It's flat.
Torn.
It's not stuck up where it's. You could do that.
They think it's paper.
Nope.
Can I get one more? Do I have time to get one more Atlanta question?
2 minutes.
Great.
Yes.
Okay. A pastor, Greg, writes from Atlanta. Me and my fellow followers have heard the show on 8:60 a.m. and we are all wondering why the medical profession has decided not to be truthful about medical matters.
I don't know what they're talking about.
Okay.
Who's not truthful? We're truthful.
No, the medical profession, meaning the surgeons.
I think he gives examples there.
Okay. I have been told I have a bulging disc and need surgery. People in my church have been told that they need replacements and they need to get surgery on their elbows and even treating scoliosis with rods. All these ailments can be treated with your method, you say. My newest question...
Well, they don't know these methods, though. They're going to surgeons who are not trained in this. This is musculoskeletal medicine. They're not lying. That's all they know.
Right. No, they're not lying. But here's another one, and I have an answer because I heard it today on the news. My newest question is, can stem cells help injury to my neck?
The answer is absolutely no.
And there was a doctor talking about that today on the way in. He said, do not go for stem cells because it's not going to do anything.
It's a scam. Stem cells are in utero before you're born.
That's right.
Doc, wait a minute.
Not afterwards.
Then he's right. Then the medical profession is not saying the right thing.
He said the medical profession isn't saying the right thing. You and Paul are saying the right thing.
We're saying the right thing.
Yeah.
Well,
he is right.
Yeah. They implied that they're lying, but that's not true.
They're just not correct.
They're just
There's
not
a limit to what those stem cell treatments can do. This can be harvested out of your bone marrow, at any time. But the older you are, the less stem cells there are in the bone marrow. That's what
one of the doctors said. That's exactly correct.
But they don't change. You don't get a cell that's going to change into ligament structure, a ligament cell, or change into a muscle cell. That doesn't happen.
They were saying the same thing you and Paul said.
The problem with that idea right now is that it's a little early. How are you going to make that stem cell turn into a knee cartilage versus something else?
But if you have a ligament sprain, Paul, why just put a steroid in there? That heals it. You don't need stem cells.
You wouldn't do it for a ligament sprain. You do it for other problems. But
what?
Stem cells.
In my opinion, it's a little early. I wouldn't do it on me.
No, I wouldn't do it on me either.
It just sounds good, Paul. It sounds good. Stem cell. I have stem cell. Yeah. Look at me now. Ooh.
And it doesn't work.
But nobody improves on it.
I hear that wonderful music.
Let's see you, Paul.
Paul, thank you again for calling, my friend. Have a good day. And everyone out there, have a great day. And Dr. Pannozzo, again, you're the best, man. I mean, what you do for people, there should be a picture of you at every temple and church. 561-381-5800. 561-381-5800. Thank you so much. And new lady, thank you so much for being here. We'll see you next week. Goodbye to all. Goodbye.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.